as we were talking about having a panel full of young women, to have young women talking about drugs as an issue for youth. Nazlee.
Thanks, Alan. So I'd like to thank the Civil Society Task Force for inviting me to speak today, and thank all of you for attending. So as mentioned, my name is Nazlee Maghsoudi, and as also alluded to, you may be able to tell that I'm a young person, and I'm bringing the perspective of youth to the panel today, and perhaps young women as well. So in my role on the board of directors at Canadian Students for Sensible Drug Policy, as well as my involvement with the nightlife harm reduction program that works with youth in Toronto, I have worked extensively with young people who use drugs, and as well as young people who have been negatively impacted by our current drug policies. In addition, I'm also representing, as mentioned, the International Center for Science and Drug Policy, which is an international network of scientific, medical, and academic experts in fields related to illicit drug policy that are working to bring evidence and science to drug policies. Hence, my comments today are informed by my on-the-ground work with youth, as well as my belief that drug policy must be guided by science and evidence. And when the research indicates that something isn't working, change is essential. So I'd like to focus today on Article 33 of the Convention on the Rights of a Child, as this comes up time and time again in the discussion of drug policy and the need to protect young people from illegal drugs. And in fact, it actually already came up today, so point taken. As the only explicit mention of narcotic drugs and psychoactive substances in international human rights law, according to Article 33, state parties shall take all appropriate measures, including legislative, administrative, social, and educational measures, to protect children from the illicit use of narcotic drugs and psychotropic substances as defined in the relevant international treaties. So we can all agree that protecting youth is of the utmost importance. What I would like to focus on today is the extent to which scientific evidence demonstrates that a punitive approach to drug policy is the most appropriate measure for protecting youth. I should also note that the evidence I am presenting today will, in the interest of time, only focus on a few of the many negative health and social outcomes that youth experience as a result of conventional drug policies. So evidence has repeatedly shown us that conventional approaches to drug policy, namely supply reduction efforts, have been ineffective in meaningfully reducing the accessibility of illegal drugs among youth. As anyone working at the grassroots level with young people can tell you, it is no secret that youth have pretty unrestricted access to illegal drugs. Drug dealers do not check IDs, and the closest supply might be just a phone call or a few lockers away. Research conducted by the United States National Institutes on Drug Abuse confirmed this, as for the past 39 years, between 81% and 90% of 12th graders, which are youth aged 17 or 18, have reported that they could obtain cannabis either fairly easily or very easily. So this extremely high level of cannabis availability among young people has been sustained despite substantial increases in the federal drug control budget, indicating that increased efforts to enforce cannabis prohibition have been unsuccessful in preventing youth from accessing cannabis in the United States. Similarly, in the European Union, research from the past year has indicated that 58% of young people, aged 15 to 24, believe that they could either very easily or fairly easily obtain cannabis in 24 hours. Other metrics of supply also demonstrate that access to illegal drugs, particularly among youth, has been, for the most part, unaffected by drug control efforts. And in some cases, the availability of illegal drugs today is greater than ever before. Peer-reviewed research from the International Center for Science and Drug Policy has shown that since 1990, despite increasing investments for enforcement-based supply reduction efforts aimed at disrupting the global drug supply, illegal drugs have generally decreased in price, while drug purity has increased. This means that among today's youth, the availability of illegal drugs is generally greater than ever before. We can therefore conclude that prohibition has not been shown to be the most appropriate measure for protecting children from illicit drugs by limiting their access to them. So given that supply reduction has been unsuccessful in significantly or sustainably reducing the availability of most illicit drugs, it is time to consider whether alternative approaches may be more effective in doing so. By allowing governments to set legal age restrictions, The strict legal regulation of illicit drug markets could, perhaps counterintuitively, actually be more effective than prohibition at restricting the accessibility of illegal drugs among young people. Age restrictions can be used to prevent the purchase of illegal drugs by youth, thereby changing the current situation, unfettered access to cannabis, for example, to one in which obtaining cannabis is no longer perceived as very easy or fairly easy. This does not discount the paramount importance of prevention efforts, which are, of course, vital to protecting youth from misusing illicit drugs. But as we have seen in the case of tobacco, market and regulatory controls, combined with public health education, can be effective in reducing use, and therefore protecting youth from the harms of drugs without resorting to mass criminalization or harsh prohibitions. The Framework Convention on Tobacco Control shows us that an international regulatory framework for non-medical and non-scientific uses of drugs is possible. Different contexts will call for different regulatory measures. A one-size-fits-all approach will of course not be appropriate for every state or every substance. However, taking control of currently unregulated illegal drug markets can give states the tools to meaningfully limit youth access to drugs, something which has plainly not been possible using our current policy tools, where all control is abdicated to unregulated criminal entrepreneurs. Strict legal regulation is therefore a promising alternative to prohibition and may be a more appropriate measure, as required by Article 33, for protecting children from illicit drugs. Now, the increased accessibility of illegal drugs among young people is just one way in which conventional approaches to drug policy have failed to protect youth. According to the World Health Organization, data suggests that a substantial portion of the global population of people who inject drugs began injecting as adolescents. And because young people who inject are more likely to engage in risky behaviors like sharing non-sterile injection equipment, they are more vulnerable to HIV infection than older people who inject drugs. Nevertheless, the scale-up of youth harm reduction services, including in the form of the comprehensive package recommended by the WHO, UNAIDS, and UNODC, is scarce, leaving young people who inject drugs without the means to realize their right to health. Other barriers preventing youth access to harm reduction services, such as legal age restrictions and requirements for parental consent, are also widespread. Given that young people aged 15 to 24 account for 35% of all new HIV infections worldwide, preventing injection among young people represents a key global health concern. To that end, drug policies that inhibit the access of young people to harm reduction services fuel the public health crisis of HIV, as well as epidemics of HCV. Scaling up harm reduction services can have a dramatic impact on reducing the risk behaviors that increase the vulnerabilities of young people to blood-borne diseases. The experience in Switzerland is quite illustrative. In the 1990s, a national policy of harm reduction was implemented in Switzerland, which involved scaling up supervised injection facilities, needle and syringe programs, and methadone maintenance treatment. Not only did this have a major impact on HIV prevention, it also had the secondary impact of reducing the incidence of injecting initiation. After harm reduction was scaled up, the proportion of new injectors in Switzerland dropped by over 80%, showing that this policy change was reducing the risk that young people were beginning to inject drugs. This is an unprecedented success story about a health-oriented drug policy framework when one is used. If we recall that the majority of people who inject drugs initiate injecting as adolescents, interventions that lead to reductions in injection drug use will therefore have a dramatic impact on improving the health and well-being of young people. My work at the grassroots level has taught me that the absence of harm reduction programs sends a very stigmatizing and troubling message to young people who use drugs, that their health is not important. Not all young people can be protected from illegal drug use, even with the most effective demand reduction efforts. Yet, for those young people that choose to use illegal drugs, the harms associated with that use could be substantially mitigated via harm reduction services, like providing sterile syringes or a safe, medically supervised place to inject. Many of the deaths in the communities I work with could have been directly prevented if harm reduction services had been available. Surely, the need to protect young people as required by Article 33 includes the provision of proven harm reduction interventions to those that choose to use illegal drugs. This proposal is supported by the Committee on the Rights of the Child, the body tasked with interpreting Article 33 and the Convention as a whole, as the committee has indicated that the development of specialized and youth-friendly harm reduction services for children and young people is vital. We cannot afford to overlook the potential positive impacts of an evidence-based approach to drug policy, one that includes the scaling up of harm reduction services and the strict legal regulation of currently illegal drugs under a public health framework. Based on my experiences working with young people and the evidence I have presented today, such an approach, based on public health, science, and compassion, is a more appropriate measure for protecting youth than the current criminal justice-led model based on a counterproductive preoccupation with punishment. Thinking about how effective the measures used thus far have been at protecting youth is especially timely given the slogan of the upcoming United Nations General Assembly Special Session on Drugs, which is a better tomorrow for the world's youth. I urge member states, UN agencies, and other stakeholders to keep this slogan in the forefront of their minds as they prepare for the UNGAS. We must seriously consider whether the measures that have been used for the past 50 years, the measures which evidence have shown have been unsuccessful based on their own metrics of success and which have created a plethora of negative consequences, can actually be expected to contribute to a better tomorrow for the world's youth. Thank you.